The lower back mobility sequence. The muscles focused on this sequence include the diaphragm, the deep spinal muscles, the iliopsoas or the hip flexor muscles, latissimus dorsi muscle, quadratus lumborum muscle, piriformis, and the gluteus maximus. 4-7-8 breathing. Use this breathing method as a relaxation technique or as a way of timing your stretching. That means using 4-7-8 breathing to determine how long you hold the stretches in many of my videos. One cycle of 4-7-8 breathing consists of inhale through your nose for a count of 4, hold your breath for a count of 7, exhale out of your mouth for a count of 8. For relaxation, start with 5 cycles every hour and increase as you gain experience. For my mobility sequences, determine how many of the cycles per stretch, and that is how long you hold each stretch. Beginning on your back, rest comfortably and bring your left knee to your chest, and then you will hold this for 30 seconds. Now switch, bring your right knee to your chest and hold that for 30 seconds. Now we begin to stretch the lower back by bringing the left leg up, and then we will bend it over to the right. You can put your left foot behind your knee, or you can put it in front of your knee, or you can reach your foot outward across the floor as shown in the insert. Now we switch sides. Bring the right hip and the right knee over the left side. Place your foot behind your knee, in front of your knee, or as the insert shows, reach your right foot out in front. Hold this for 30 seconds. Hip flexor stretch. Now roll onto your side. We're going to stretch out the top leg. Drop the top foot behind you, as shown, as far back as possible. And if you're doing this on a bed, you can drop your foot off the side of your bed. And drop your top shoulder behind you in order to straighten out your upper back. I can also move my bottom foot forward a little bit to increase the stretch as well as improve my balance. And if I can, I'll reach back and grab my ankle and pull a little bit harder to increase the stretch. Beginning with the diaphragm stretch, gently wrap your fingers below your rib cage, pressing gently upwards, and then breathing in and out 10 times into your fingers. Next, to work the deep spinal muscles, do lumbar flattening, where you're gently tilting your hips upward and downward, trying to get your lumbars, which is your lower back, to touch the floor. Next, we proceed to work on the hip flexor muscle, also called the iliopsoas muscle. Assume this position, and you may put a pillow underneath your knee for comfort. Make sure your rear heel is pointed outward a little bit. Keeping your back straight, you gently glide forward. And if you can, try to squeeze your butt muscle. Here I have my fingers pushing into my butt muscle as a way for me to squeeze against my fingers to cue me on how to squeeze my butt muscle. Squeezing the butt muscle in this position helps to add another stretch to the psoas muscle. Next, we stretched the right-sided latissimus dorsi muscle because it's opposite our rear leg, which here is the left. Elbow up over my head and use my left hand to gently pull my right arm upwards, and this stretches the latissimus dorsi. When completed, you switch to the other side, so I will briefly show the same sequence on the other half of the body. As a reminder, you can hold each step of this stretch for 30 seconds or one cycle of 4-7-8 breathing. Here's the gentle forward glide, then squeeze my buttocks, and now I reach my elbow overhead, which on this side is the left because it's my right leg that's behind. Next, we move into the child's pose. which also stretches the latissimus dorsi muscle, plus we can add an additional stretch to work on the quadratus lumborum muscle. After holding this stretch for 30 seconds or 1, 4, 7, 8 breathing cycle, you then can reach one hand across the body, and in this case it's going to be the left hand reaching across the right. I then bring my right knee a little bit backwards. So now I'm stretching the side muscle, which is the quadratus lumborum muscle. When I'm completed with that stretch, I switch positions and reach with my right hand across the left side of my body and bring my right knee backwards just a little bit. When we're done with this stretch, we lay on our back and we focus on the piriformis muscle. The piriformis muscle is also a butt muscle, but it's much deeper than the gluteus maximus muscle. First step is to take one foot and cross it over the opposite knee and give a gentle stretch like this. Now after one breath cycle of 4, 7, 8 breathing, you can bring your right knee up to your chest in this figure 4 position, which allows you to stretch the piriformis as shown. You can increase the stretch by curling up and bringing your right knee even closer to your chest. When you're done with this stretch, you now can start the piriformis on the other side. You can place your foot on either side of your knee. You then can move into the figure 4 position and bring your chest to your knee. Some people find it beneficial to use a tennis ball or some other hard ball to get at the deep tender points of the piriformis or the quadratus lumborum. Here is the typical placement to do a piriformis tender point treatment with a tennis ball. You can move your hip around or you can just rest on it for 30 to 60 seconds. If this causes tingling into your toes, just reposition the ball. I next demonstrate the quadratus lumborum tender point treatment using the tennis ball. It might take some practice for you to be able to best localize and where to place the tennis ball. When you're completed, we now end this by bringing the knees up to the chest one at a time for a final stretch. Then hold this stretch for 30 to 60 seconds or 2, 4, 7, 8 breathing cycles. Switch to the other leg and you'll be done.